Hi, this is Dr. Eric Thomas for Nutmeg Dermatology, talking about one way to improve both precancers due to the sun and acne, and also helps rosacea. What can possibly take care of such seemingly very different things? How can it work? So this is really elegant biology. I love it, and I want to explain it to you. In our own bodies, we have a chemical which is part of the way that we produce red blood cells. Fancy name, aminolevulinic acid. It doesn't matter. We call it ALA. And in Europe, they use a close relative. In any event, this is, you want natural? We could give you natural. Here you go with your own body's chemical. Now, you don't have too much of this chemical, and it's pretty well hidden away from the sun. It's down where red blood cells are made. And that's a good thing, because this chemical has a characteristic and ability to absorb certain colors, wavelengths of visible light, and ultraviolet light too. And if a cell contains this chemical, the energy is transferred to that cell and can damage it, even kill it. There actually are people who have a condition called porphyria, which allows this chemical to build up in their skin, and they cannot go to the beach the way you or I would. They'll get sunburns and blisters. Not a diagnosis we want to talk about too much. It's off the topic a bit, but I do want to emphasize how natural this chemical is. So what we do is we apply it with a little cosmetic brush wherever we think you've had too much sun damage, or where you have acne, and wait a while. Usually in the office we wait 1 hour. Some of the studies originally were done overnight, but people find that's inconvenient, and research has shown that the results are pretty much equivalent. So after about an hour, here's the key concept. Some of the skin cells have absorbed more of this photosensitizer than others. The ones that really pick this stuff up are rapidly growing precancerous cells, and in Europe, in some countries, I'm told they use it for certain true cancers of the skin. And how about this? Glandular or oily acne-prone tissue. Also rosacea, the acne type, not just the red type, absorbs it fairly well. So here it goes. Here's an hour it goes by, and you have the rapidly growing cells that have a fair bit of this chemical, and the slow normal cells. Then we flood the area with bright light. It could be any color. Blue is good because if you look at the absorption spectrum of this chemical, there's a spike right around blue, which allows us to keep the course of exposure down to about 16 minutes and 40 seconds, which in studies was the standard. It was 10 joules, Joules, of energy. Anyway, there you are sitting with this kind of open horseshoe-shaped illuminator. And we do have people wear little goggles, although it's not ultraviolet, it's pretty bright. And it can be adjusted this way for the face, ears, or it can be adjusted this way for bald-headed guys to get the scalp. And we have experimented using it actually for the chest for acne. And yes, it can be done for the upper arms by putting them on a table. So what happens is that the light, the chemical, all of it together kills a lot of the bad cells. And how does it feel? What's it like afterwards? Well, it may sting or tingle a bit, like pins and needles if you really needed it. This is mainly for sun damage. And that's not a major issue. You could either just back out. We use little chairs that are on wheels, or we could put a cold pack or a fan on. And in any event, after 16 minutes and 40 seconds, that's it, you're done. Usually it looks fine. Now, over the next couple of days, there can be some redness, And if you really needed it, there can be little localized areas of irritation. Often it's almost a non-event, and people can usually go about their normal activities, just being careful of bright outdoor light for the next 2 days, because you remain sensitive for 2 days. However, if you really needed it, then there can be redness that can go on 5, 6, 7 days. In any event, it's a great technique, at least in Connecticut. In our practice, it is covered by insurance with co-pays and deductibles, certainly for sun damage. Acne is another issue. That's something that is very much person to person and insurance to insurance, so that could be a problem, getting it paid for. So I think it's a wonderful technique. It avoids a lot of the 3 to 4 week irritation seen with 5-fluorouracil or a lot of the other creams. Generally speaking, it's a lot less expensive. Some of the creams, I've had someone tell me there was $700 for a tube of 5-FU, which is remarkable considering what it used to be back in the day. But that's the way folks are doing it these days. So I hope that you can find someone who does photodynamic therapy in your neck of the woods. It is a little time consuming. It does use a chemical which we get paid back at 6%, so it's not really as popular as some of the other techniques. Much easier to just write a prescription for something, but it's much kinder, much gentler, really much more patient-friendly, and that's what we try to do, get you better in the way that we want to be treated. So and again, this is Eric Thomas for Nutmeg Dermatology. Give us a shout if you want, and we'll try to work any of your questions into future shows. Best wishes.